I'm Dr. Sharath, Chief Consultant Plastic Surgeon at Arete Hospitals in Hyderabad. Today I wish to speak to you about breast reduction. Breast enlargement is a common consequence of pubertal growth spurt. But that is girls which when they are maturing and about 12 or 13 they start enlargement of the breast, and when they reach about 18 or 19 they develop their reasonable what you call as a growth at that stage. Some have a disproportionate growth of these breasts which can cause them problems like neck pain and itching below the breast crease, accumulation of sweat, fungal infections, and ask for correction of the breasts. Now the awareness for reduction is on the rise. Earlier these young girls used to feel socially not so comfortable and not comfortable in playing active sports like tennis or running or jogging, and then I have known of youngsters who have quit their sports like tennis because they were quite inhibited in participating in such activities, made them unwanted and unnecessary focus of attention. Many did not realize that there was a surgery available which was safe, deliverable results which would make them happy and get on with these activities. A breast reduction involves depending on the size of the breast and the technique of breast reduction, some amount of scarring which can be around the areola, which is between the dark areola, the dark part, and the normal skin, which is less visible, and there is an inverted T or a vertical scar which is there below the areola, apart from the scar around the areola. Surgery is done under general anesthetic. Pre-anesthetic bloods are done. Initial consultation with the plastic surgeon helps in understanding the extent of surgery, duration, and recovery period, the activities which can be undertaken after the surgery. Surgery is done in about 4 to 5 hours, as can be done under general anesthesia usually. There is an overnight stay. Most surgeons do prefer. Some might discharge as a daycare. Drains may be put by some, drains might not be put by some. Drains are tubes which are placed between the chest wall and the breast tissue, which drain out fluid. After surgery, you are advised to wear sports bra which supports the breast, and a week is when people advise taking a bath. In some, after 2 to 3 days with a waterproof dressing, they take a bath. The dressings are changed then. The suture line is kept adequately moist using an antibacterial ointment, and sports garment is worn on that. Wounds usually heal in about 2 weeks. Sometimes delayed wound healing might happen, which takes a couple of weeks longer. Local scar will be there, which needs scar management techniques. Postoperatively, some women ask if their breastfeeding ability is affected. It may be affected moderately or to a significant degree, and this needs to be told to the women prior to the surgery. Some amount of disturbance of nipple areola sensation may happen, but usually it does come back after a couple of months. Some individuals, the skin of the areola might dry and peel off, and then new skin might develop. Very rarely partial loss of the nipple areola or part of the skin may happen with wound gaping issues. If an adequate planning is done by prior consultation with the plastic surgeon, surgery can be undertaken safely and to the satisfaction of the woman who needs it, and social activities can be resumed, sports activities can be resumed, restoring the confidence of the woman. That would be something that an awareness needs to be created among their friends also, if there is somebody who is affected with a similar problem.